very good afternoon to all professors, associate professors, lecturers, and attendees. Thank you to each and every one of you for being here with us today. So my name is Dr. Aisha Natasha Musa. On behalf of Center, I will be your moderator for today's webinar series. So research have always been one of the main pillars in a university. Without a good principal investigator, a research may fail its main objectives. Therefore, we believe that in understanding the role of a principal investigator, a researcher would be able to complete their research without much obstacles. I am proud to introduce Associate Prof. Dr. Ahmad Izuanuddin Ismail for today's webinar series entitled Primary Investigator Responsibilities. Prof graduated initially from Dublin in 2002, obtained his MRCPI in 2007, and completed his respiratory training in 2012. He is known to us as our Deputy Director of Hospital UITM, but he is also one of the renowned researchers in UITM itself. Since he joined UITM, he had received many international grants, such as the influenza study worth 1.16 million, and also many local grants as well. He was and is currently a primary investigator of many respiratory-related research, both investigator-initiated and sponsored studies. I believe that we could learn from his vast experience being a principal investigator. So without further ado, I would like to invite Associate Prof. Dr. Ahmad Izuanuddin to the stage.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Thank you, Dr. Aisha, for the kind introduction. Can I just check that everybody can hear me clearly and see my slide?
Yes, Prof.
Okay, thank you. So first of all, thank you very much to Centre. Centre, actually, to be honest, just going back to the history, is my first administrative post in UITM. When our predecessor, Prof. Tengku, left to a greener pasture, he was the single-hand man looking after 3 sections of medical department at that time. He was the head of department, he was the head of a center, and head of postgraduate. So when he left, we noticed that none of us can hold that one single post. So we've divided between the 3 of us. That was myself, Prof. Sazli, and Prof. Rohana. So Prof. Sazli took up the head of department at that time, and Prof. Rohana looked after the postgraduate until now. And I've briefly hold the coordinator for Centre, I think for about a year plus before I pass it over to the next person in line. All right. So what I'm going to do over the next half an hour or so, the first 20 minutes is going to be a dry talk. In fact, if you are going through GCP training, you might be seeing the same slide that I'm going to show next to you. But this is important because each of us would like to do research, not be or continue to stay in the university area, because we do know that apart from clinical services, we also have another responsibility apart from teaching and so on, would be to explore new avenues, to do clinical trials and so on, so that we can come up with a new knowledge to be disseminated to everyone else. So being investigator, being part of the investigator or part of the research is very important for all of us, for our KPIs and also for our future careers. So I'm going to share with you the slide that's taken from GCP training course. But what I'm going to focus over 10 minutes or so towards the end will be to share my experience running. I've listed down here about 8 or 9 clinical trials that I've run over the years, and especially the latest few trials during the COVID pandemics that we actually face huge challenge, but with all the support from everyone in the teams, we managed to completed few of them, even managed to get myself and Aisha. We've just published a paper in a Q1 journal, BMC Infectious Disease, on our influenza study. So I'm just going to share with you the tips and the tricks in terms of what are the requirement or even the different types of meeting. I sometimes even confuse what meetings I'm going to, because for you to start a study, there will be a feasibility forms that you have to fill in, followed by site selection visit, site initiating visit, investigator meeting, and so on. All right. So there are few things that I can share, and in terms of how we can promote everyone else to join this club, and hopefully we can see few more millionaires from research grant in our faculties over the next few years. Okay, so this is a snippet of what's involved in clinical trials. I mean, most of us would know, and this is the area where I'm hugely interested on. And one of the reasons why I keep doing clinical trials will be because when you become a clinician, you are exposed to all this new development in terms of the drugs development and so on. And you do know there's always a way or a better way to improve the outcome in your patient. So by having this investigation or research done in your own setup, you can ensure that all your patient would receive first-hand treatment if they have any new drugs coming in and so on. And this is particularly true in some of the respiratory illnesses, because most of them are so-called hopeless disease. I'm not saying hopeless disease in the sense that even if we have medication, for example, medication for COPD, even at this stage, we don't have any medication that can reduce or prevent mortality. The best medication for COPD will be to stop smoking. We have that for the past couple of years. But with the improvement in terms of the treatment and so on, we can ensure that the patient with COPD, they don't deteriorate further, their lung function can be preserved and so on. And by doing that, we can maybe slow down their mortality rate.
Recording in progress.
And most recently, we've received offer to do a study in pulmonary fibrosis. And we all know that the patient with pulmonary fibrosis, their prognosis is very protected. I mean, very guarded prognosis in patient with pulmonary fibrosis. If you don't give any treatment for them, and the only effective treatment for pulmonary fibrosis will be a lung transplant, and the fact that we've only 10 lung transplant over the past 15 years or so in Malaysia, so we need to explore or going into the uncharted territory to try and find a suitable medication that can help this patient. So by involving in these studies, I do get some satisfaction in terms of seeing our patient improve with this new medication. And one of the best example would be the Thiosphere studies. And this is what we call the original studies that confirm the appropriateness of using Respimat Spiriva, which is a common medication nowadays in COPD, and that can be shown to be effective. It's an aerosolized medication. It's almost as good as giving nebulizers for this patient. And I mean, all of us would be very much happy to have access to this medication firsthand much earlier than the other colleagues in Malaysia at that time. So being a primary investigator, among your responsibilities, you need to ensure yourself to be qualified. Basically, the only one qualification that you need will be to pass your GCP. So it's very simple to be investigator. Of course, you need to be familiar with the agreements in terms of the finance support and so on. You need to ensure to have a very good teams behind you. Everybody just see me as this highly successful principal investigator, but you don't see what's behind me. I mean, I have very good and dedicated research assistant, Cik Nadia and Y, and I have a very good team support. I have Dr. Aisha, I have Dr. Arif, Dr. Amin, and nowadays we have a few other new fellows joining in the recipe teams who can help us propel through the requirement to complete individual clinical studies. And every individual studies would pose different challenges, but if you work as a team from RA, from investigator, from support staff. I mean, my MLTs involved with the lung function studies, Aisha, Fendi, Hilmi, to name a few, and also support from central staff. For example, in our influenza studies, we have the two science officer from Centre heavily involved with making sure that we've collected sound and collected data and easy for us to interpret this data and to ensure that we actually follow the proper instruction in terms of completing those studies. So all you can, I mean, most of probably just see, oh, this principal investigator, so-and-so collected so-and-so amount of research grant, but you have to really have a very good team behind you to ensure the success of the study team, okay? But at the same time, don't be scared, all right? Most of us started as one single person doing the study anyway. I remember one of the first study I joined, I have to part of Prof. Arwah Prof. Khalid's team, and in fact, I did join his Pura studies, even going to Kota Marudu to collect the data. And I also involved in endocrine studies. We do know that empagliflozin was one of quite common drug commonly prescribed in diabetes at the moment, but I think in 2010, 2011, our UITM is part of the EMPA-REC studies. And I was involved with seeing diabetic patients at that time because at that time we still run so-called general medical clinic. So don't be scared, even if you have one single person unit, because when you want to run the studies, yes, you do have the option of hiring a research assistant and so on, but when you first start the study, you will not get 1 million straight away, all right? So it's very difficult to ensure that your research assistant is well paid at that time and so on. So it's been difficult because you probably ended up having to use your own money to support their salaries and so on in the first place. So my advice to colleagues out there who's running a single hand department would be to involve with us. I mean, in fact, this is what we did with our nephrologists. They do have a clinical trial involving a nephro drug and so on. They can actually hook up with our clinical or research assistant, and we can get them to help you to run or get the study running. Of course, he or she will be negotiating with me in terms of the quantum of their services and so on. But don't worry about it. we can speak over coffee and so on and discuss it. And I can assure you, I will not be charging a lot of money from your research fund. So you can start the study even if you run a one single department, a one-person department. You can still do it. And I remember asking our pediatric respiratory physician to be involved with our asthma study in adolescent, because it's part of a big respiratory team. It's just a different category of patient to be involved. So we can help you. And I think at the moment, the three main unit, a well-established unit doing research will be our department, respiratory, but the cardiology and endocrine also running multiple clinical trials. And don't forget the support from Centre as well, because we can help you in terms of the running the initial part of the studies. I see Jamil is there. He's been involved with, he's been helping us, he's been helping Arwah Datuk Khalid and the cardiology team, and he's part of Centre all this while since the day one of his employment with UITM. So you do have this support services provided by Centre to promote or get your involvement in the studies. The next one is to talk about the medical care. When you run a studies, you always have this conflict, whether you want to be a doctor or you want to be investigator. Being investigator is all about following the protocols. But being a doctor is all about giving priorities to the care of the patients. So sometimes you do need to have this separation, and knowing when you should withdraw your patient from clinical trials if the patient develops some severe adverse reaction or adverse events. You need to assess whether do you need to broke the code. Broke the code meaning that you want to know whether this patient receiving placebo or the active drug and so on. So you do need to have that distinction between being a treating doctor and being a principal investigator or part of the investigator team. Being investigator is all about following protocols. Remember, when you have the protocol, they will give you the inclusion criteria, they'll give you the exclusion criteria, what medication that you should refrain on. I'll give you an example. The studies that we want to run, which is the primary fibrosis, I remember the patients cannot even be on the current 2 active drugs used for primary fibrosis. But of course, we do need to look after the welfare of the patient, the well-being of the patient as well. If you think you need to take out this patient from the study, you have to do it, you have to do it. All right? And you need to ensure that if you want to do that, the communication between you, the sponsor, the patients, the research board, the ethics committee should be kept as professional as possible. There are steps that you have to do. For example, if the patient develop serious adverse events, you need to ensure that that needs to be reported within 24 hours. You need to ensure that the reports goes to our ethics committee in UITM as well as the National Ethics Committee. So all this has been clearly outlined in the study protocol. All you have to do is just be compliant with that protocol and follow. Orang kata daripada A to Z, you have to follow everything. You cannot skip anything in the clinical trials. But at the same time, being a treating doctor, your priority will be towards your patient. So if you think your patients did not benefit from this, and the patient is asking or would like to withdraw their consent and so on, then you have to give that decision to the patient to be made. And you should not be the one dictating that, or asking, or keep coercing the patient to remain in the study even though you saw that the patient developed some serious adverse event and so on. So that always important to bear in mind when you comes to this. Okay. And the next thing that you need to be aware about is what is it in the investigational products, the IPs. You do need to have the sound knowledge on any of the new medications that have been tested there. You do need to have, I mean, you don't have to be a pharmacologist, but you being a clinician, I'm sure you are well aware of the new development of the new treatment options in your patient. So you do need to use that knowledge and select the products or whatever new medication that they ask you to run the study. I think the other responsibilities that we need to ensure is the way you do the randomization, which is normally is done centrally. How do you take informed consent? It's always important for you to disclose what is necessary. Okay. So for example, most of our studies, what we do, if you look at our informed consent, each of the informed consent is probably what, 10 pages, 8 or 9 pages. Okay, so you do need to highlight what are the important concerns about individual investigational product. What does it involve to the patient? Even knowing how many mils of bloods to be taken from the patient. Okay, what are the procedures involved? How frequent you'll be doing the procedures? If the patient is supposed to have a CT scan, how often do they have a CT scan? What are the individual risks of, for example, if you need to do monthly CT scan, which is not happening, but I'm just giving you an example. So if you have to do a monthly CT scan, you need to ensure that you explain carefully to the patient why it has to be done, and so on. I mean, for our pulmonary fibrosis is done after 3 months, which is almost similar to what our current practice is. So it's not doing it on a monthly basis and so on. But if you have that, you need to understand why it has to be done in such a way and explain that carefully to the patient. The spirometry, how often do they have to do it, and so on. And one of the latest thing that favors by the sponsor is what we call the patient reporting system. So they give the patient something like a mini iPhone or something like that for the patient to report their daily symptoms. Okay, I think it's all about collecting as much data as possible from any of the studies, and try to come up with something towards the end of it. Okay, so we have most of our COPD or asthma studies, they will have the ePro, so electronic patient reporting system, where the machine or the phone will ask the patient to prompt the patient to key in their daily symptoms, how often do they need to use reliever inhalers and so on, depending on what information they have to collect. So that's something, I mean, if you have a younger IT savvy participant, that should not be an issue. But if you're studying elderly population, you do need to spend considerable amount of time to train these people to make sure that they put in the actual data that is required in the iPhone. Okay. The next one is about recording and reporting, and this is very important, especially when we want to ensure the integrity of the source data. Okay, we are a bit lucky in UiTM because we do have our electronic data, UNIMEDs. But what the sponsor needs is they want to see the audit trail. So for example, if you make any changes to it, if it's written data, there's a way to do it. You should not just scratch around it and so on. It should be just one line, signed and dated. Okay, but with electronic data, say for example, I'm giving you an example of our UNIMED system. You key in the data today. If you want to change it and so on, you can just delete it and put it there, but you will not see the audit trail. Okay, so what you need to ensure is every changes that you need to put in your clinical notes and so on, it has to be captured. They have to have some audit trail to it, and even when we have the sponsor coming in to look at the data and so on, he or she might suggest some amendment to it. So you need to have a way to ensure that all the changes are captured and kept in the audit trail. Okay, and this is very important because when you want to come up with any forms of reports and so on, they will look back at the source data. And it's very important to keep the integrity of the data in case if you have to be audited. And we do know in clinical studies, the most that we worry about is the FDA audit. Alhamdulillah, so far, for RESPI studies in UiTM over the past 10 years or so, we have not been audited by FDA yet, but I know colleague in UiTM, I will not mention names, has been audited, and it is quite scary when they come in. Okay, and that is also important when you decide on how many patients you want to recruit in the studies. And these people, the auditor, they always like to come in when you do recruit quite a high number of patients, because the higher the number you recruit, the more likely that you make some form of mistakes. Okay, but this is what we call the number games. All right. So when we want to be involved with the studies, of course, the sponsor will like you very much if you can recruit as many patients as possible within the shorter time as possible. Okay. And you don't want to give too little patient either, because when you need to fill in the feasibility questionnaire in the first place, okay, you need to put in what is your target number. Depending on the duration of the recruitment, you can decide in a month how many you can screen, how many you can randomize, but you need to ensure the number is not too small and it's not too big. It's something that is achievable. What's the sponsor like, or the reason why they kept coming back to us? Because so far we've managed to keep our target number or even exceed our target number. We have not failed in terms of getting the target number until recently, which I'm going to tell you later during my talk. So that is very important. When you deciding that you want to be part of the studies, you need to ensure that you have a reasonable number of participants that you want to target, and it's something that is achievable. And people used to say that You need to contribute as many patients as possible so that your name will be captured when they publish something. Okay, I tell you what, that's not 100% true. Okay, I've managed to get for STEM TB studies, we've managed to get our names, not usually the names is like behind in the acknowledgement part, but for the STEM TB study, I managed to get the publication in the Grey Journal. Grey Journal for respiratory is International Union of TB and Lung Diseases, or what we call union, and we managed to get published in that journal with just 2 patients being recruited from our side. Okay, so and I know a colleague in also got published in New England Journal of Medicine with just 3 patients being admitted. All right, so it's not just the patient number, but they also look at what we call the niche area, okay, which is the reason why we now venture into bronchiectasis studies, into pulmonary fibrosis studies, into RSV infection studies, which is what we call a niche area in respiratory where not many people would like to join. So those are the things that you need to consider because towards the end, we want some form of recognition, okay? And getting a paper or getting a paper to be published in a reputable journal, that will be everybody's ambition at the completion of the studies. So those are the things that we always have in mind when we join in. The next one there is all about making sure that you do submit your progress reports, especially to our RMI, because they want to see the progress. And with our Research Management Institute in UiTM at the moment, once you completed your study duration, if you still have unspent money, UiTM will take it back to them. Okay, so you need to make sure when you have a research grant, you do spend it well, you do finish it towards the end, okay? Or if you have to, you probably need to transfer into an active account of the studies. What did I do with my research grant? Okay, the main part is the salary for my 2 RAs. Okay, that's the main part. But at the same time, we do use that money for what we call to do research without the grant money. All right. So when we want to initiate a small study among ourselves, recipe related and so on, investigator initiated studies, and if we cannot secure any national grants and so on, this is the avenue for us to use and promote research in our department, in respiratory unit and so on. Our master students, if they have any topics or related to respiratory, they can apply from us to have the grant and get the money in. And also we can use that money for publication fee and so on, and we've done that in our department. So when you have the grant money, there's a budget grid that you have to fill in, so you know how much that you need to spend for the salary of your staffing, how much that you need to spend for the running of the studies. But at the same time, there's always a balance from that study that you can use for other purpose to get yourself more involved with the research and so on. Okay, safety reporting is important, and as I mentioned earlier, for example, if you have any severe adverse event and so on, you do have the timeline when you have to report, who you should send the report and so on, and it's very important to keep open channel communication with your ethics committee, because they need to know if any adverse problems happen, especially in UITM and so on. So you do need to ensure that is running properly. If you have premature termination or suspension of the studies, and I would like to relate this to our most recent studies. After we received the 1 million for influenza study, we were invited to be involved with another influenza study, but now studying elderly population. But we do know with influenza, this patient needs to be admitted to the ward, and happened that these studies coincide with the COVID pandemics. And number one, since COVID pandemic, everybody is wearing masks, and I do hope if you are listening and sitting in the crowded area, you kept your mask on at all time, and by doing that, we are seeing less patient being admitted for influenza. And even if they're admitted, most of them would contract COVID rather than upper respiratory tract illnesses. So in that particular studies, initially we were supposed to recruit about 150 patients, but obviously after a few months, we know that it's almost impossible to get that patient. And following discussion with the sponsor, we've informed that we would like to cease our involvement in these studies as we cannot commit towards the end. So being a principal investigator, you need to have this knowledge around you. Because to sponsors, of course, they like you to complete or get the number required for their studies, but they also would like to know if, for whatever reason, you cannot commit to the number, and they want to know as early as possible, because they can rechannel some of the budget, maybe because most of the study, there are multi-centered studies. So if they manage to be aware of this issue as early as possible, they can perhaps rechannel that fund other center and maybe get other center to support us and so on. So it's very important that you need to keep yourself aware on all the progress of the studies. And as much as possible, we try not to have early termination. And as I mentioned, suspension also. I can give you an example of our TB study again. It was suspended for quite some time because one of the medication was found to have abnormal liver function. So eventually we received a letter to suspend the studies, but towards the end, they actually managed to get it cleared by FDA again and managed to complete that study. So open communication, you always need to be aware of the progress of your studies, and do need to keep plans ready in your head on what to do if this thing happens, the premature termination or suspension of the studies. And last but not least, the final report by investigator is also important to be put in. And with the final report, the thing that they would like to look at would be the number of patients being randomized. And for your ITM, they also want to know if you have publications with it, because for MyRA score and so on, it's not just the amount of grant received, but also if you have any publication to it and so on. All right. So over the next 5 minutes or so, I'm trying to recall a couple of studies and try to introduce few terms in terms of the meetings or the steps that is required to run the studies. So let's start off with that first. So of course, number one, you need to establish yourself to be investigators. Okay, not everybody can be primary investigators straight away. And in fact, when they want to choose you as a primary investigator, they would like for you to have some experience being investigator in the first place. So I'm very lucky to have Arwah Datuk Khalid and Prof Tengku as my supervisors before, as my primary investigator before, and even cardiology is not my thing at that time. I just put my names in so that they can see the experience behind you before they can select you as primary investigator. So, I mean, even like nowadays, if somebody offer me to do cardiology research, I'd probably say no, or endocrine research, I'd probably say no. But for a start, just get yourself, just get your names in any of those studies so that they can see that as your experience. Okay, so the first step, once they notice you as an investigator, they would send you the feasibility questionnaire. So feasibility questionnaire basically would like to know if you have any database of your patient. Dr. Aisha and Dr. Amin probably can confirm again when there were my MOs and when they were being part of my RESPI fellow started in Hospital Selayang. I always insist them to fill in Excel sheet on bronchoscopy and so on. And we do know that we got quite a number of publication from those data by collecting data. And when I involved with as a deputy dean of clinical services, I want to get it captured electronically by having Unimed. So nowadays, so long as you put in the diagnosis, we can get the patient's name, the numbers, and so on required. So as if you don't put the diagnosis, then it will be difficult. But if you put in the code, according to the ICD numbers and so on, if you want a patient with COPD, patient with bronchiectasis, we can come up with you from the Unimeds almost effortlessly. Okay, and it's very important if you have that, because most of the feasibility, for example, if you got a feasibility on COPD, they would like to know how many of your patients coming to your clinic are Gold D, Gold B, Gold C, and so on, and how many of those patients are on the certain types of medication. Because when they offers you to do a clinical studies, they want to know the types of or a section of the problem. For example, a new medication, they probably want to see, they would like to include patient who had frequent exacerbations or frequent visit to hospital and so on. So it's good to have this number handy, because these are the first thing that they will ask you regarding your patient. For example, a patient with diabetes, they probably want to know how many percent of the patient with HbA1c of more than 7, more than 10, and so on, because these are the target group of patients that they want to enroll in the study. And towards the end of it, as I mentioned, is the game number. So you need to be able to respond to them in terms of the number who you are comfortable to screen and randomize for that particular study. Okay. So once you complete it, it probably will take you about 2 or 3 months after that, and they come up with a letter saying that your site may be selected to join the studies. Okay, so the first meeting with the sponsor will be what we call site selection visit, SSV. Okay, in the site selection visit, before PKP, they would send somebody to come to our center to meet with the team to see what equipment that we have in our center. Basically, they want to know the readiness of our center to be part of the studies. So you have to be very honest what you have, what you don't have, because if you don't have certain things, these are the things that you can put in the budget and ask from them. Okay, and the good thing about doing these clinical trials, towards the end of it, okay, even some of the equipment that they will not take it back. Okay, they will just leave it with you. We have access to Fino, we have access to a simple spirometry and so on in the past. And these are some of the added benefit when you join this. I remember having a simple BSc donated to us after completing the study. Okay. Um, so once you've completed the SSV, they say that your site has been selected. So they will initiate your site, SIV, site initiation visit. And usually it will be done before or after what we call investigator meeting. So for us researcher, we always look forward to investigator meeting. I remember, I think Dr. Arif went all the way to US for an 48-hour trip. I think that's the reason why I asked Dr. Arif to go, because it's 48 hours. But it's good because they travel business class. Okay, so even though it's what 16 hours, 18 hours difference, but you are sitting comfortably on the plane, even it's for only for 48 hours visit. But apart from the travel, okay, the good thing about IM is this is where you initiate communication with other investigator in that studies. And from that, you can develop your rapport and ensure that you get more studies after that, because this is the important place for networking and so on. Okay. Apart from the meetings, you also need to look at the agreement. Okay, a good thing at the moment with the agreement, all the agreements are vetted through by our legal office, so we have less issue in terms of that. But I used to look at of being my own lawyer, looking through all the legal agreement, and I'm also have to be our own accountant looking at the individual budgets and so on. But nowadays, most of the charges are pretty much fixed. So you just need to put in, and it comes out almost automatically in terms of what are the fees for the investigators, the research assistant, and so on. Okay. And last but not least, as I mentioned earlier, I think I did mention a few of the studies that are involved. Thiosphere is a study which involves the development of Spiriva, which is our medication. So that's one of the bigger study that we have to start with. I think the amount of grants totaling nearly about 600,000 at that time, and we've included nearly about 30 patients. Emparec is my involvement with endocrine, the only endocrine study so far, looking at the empagliflozin. STAN-TB, as I mentioned, has a lot of challenges at that time. We have a period of termination, but with just 2 patients, I got a paper published in a Grey journal. Influenza flu 70 is my millionaire studies, Alhamdulillah. And I managed to get a paper being a correspondent author in that. Influenza in elderly is the one that we have to withdraw because of the COVID. And now we have 3 new studies. Endeavor is the latest, hopefully a useful medication for pulmonary fibrosis. RSV, which is another virus infection, and I hope we can get some patients to be recruited. But looking at the previous influenza elderly with only, I think even in Klang Valley, there were only 1 RSV case, so I'm not sure whether we can fulfill the requirement for the studies or not. And last but not least is the INSMET study, which is the study on bronchiectasis. And I do hope that we can contribute the number required, which is 10 for these particular studies. So each and individual studies poses their own challenges, but my advice to all the newcomers out there, you have myself, you have Prof. Azli, Prof. Rohana. We have been involved with clinical trial all these years. We have established team. If you only just starting to get into these studies, you are more than welcome to come to us and get our advice. And at the same time, if you need human resource support, we can offer you that as well. And of course, the Centre, they also have capable staff, very experienced staff, dedicated to arwah Datuk Khalid all this while, and we can help you to initiate or start off your research project, and making sure that it's not just to start, but at the end of it, you manage to finish the project and finish the research agenda. Okay. I think with that, I've talked nearly about 50 minutes now. I think I should stop here, and I'm happy to take up any question or discussion.
Let me see whether there is anything on the chat at the moment. I think we are still waiting for some questions. Perhaps I would make a start with some questions, Prof. Thank you for sharing your personal opinion, experience in the studies. But in your opinion, to start as a young PI, would you encourage them to do an investigator-initiated study? Or would it be an easier role to go as a PI for a sponsored research study?
Okay, I think you have to understand that when you do investigator-initiated studies, number one, you have to look for a grant. And I think as a young investigator, you probably have more time to prepare the proposals and so on, so which is good. But do hooked up with established researcher as your mentor, because he or she will guide you in terms of getting the proper proposal, getting a successful proposal, and the other reason why you should hooked up with them, because most of them would have some grant money in their accounts already from their clinical studies. So even for a start, you do need to have some financial support, because even if you're running an investigator-initiated study, some of the early part of the study, you probably need to use your own fund to get the research project running. So I think it's important to make sure that you have a mentor to start with, and take it from there.
Okay, we have a question here. What's your biggest challenges being the principal investigator? And how do you manage the study during the COVID-19 pandemic, which is quite relevant to us now?
Okay, let me start off with the second question there first. I think when we have the COVID pandemics, I was quite lucky because I think at that time I was towards the end of the influenza study, and we were only just about to start the influenza elderly studies, and all the three newer studies I just mentioned were in just the initial planning process. So when we have the COVID pandemic, immediately we put in measures that phone consultation or virtual consultation is something that is included in the steps of the studies, because the problem is, even if you don't run as a COVID center, your patient will be scared to come out from their house, or even been stopped at Sekatan Jalan Raya dan sebagainya. So I think we were lucky because immediately when COVID comes in, I don't have that many active studies running. So with the new studies, immediately we come up with measures to prevent that. So taking into account of having virtual consultation, having a phone call consultation, that really helps. And we just bring the patient when it is really necessary. In terms of the biggest challenges being principal investigator, I think initially, as I mentioned earlier, I have to be my own lawyers and I have to be my own accountant, and that's a bit scary initially because um, you know, all these agreement that are written in such a way that you being a first-hand medics will be very difficult for you to understand the legal terms and so on. But we've managed to change that, and we managed to get our legal office to vet through all those and making sure that we are not being disadvantaged by any of their terms. And also with budgeting and so on, I think my experience being a co-investigator do helps me a lot, and from that we do you can look at a previous budget and so on. You can come up with a comparable price, because some of the newer studies or even with the newer sponsor, they even ask you what is your reasonable fee for the investigator, what is the reasonable fee for patient visit and so on. So you do need to have some ideas for it. And I think if you ask the other principal investigator, something that I have not experienced yet would be how to deal with audit from FDA. And that is really scary because they look at every single details of your entries, of your source data and so on. And I mean, as much as possible, stick to the protocol, follow the proper ways of doing research, reporting and so on, so that you will not be audited.
Well said, Prof. So, Prof, what, in your opinion, Prof, what do you think? You mentioned a few incentives of being a PI. What do you see as an ideal PI, and perhaps what are the incentives of being one?
Okay, I think everybody keeps mentioning financial as being the main incentive. I don't get rich by running a research. I think if you really want to be rich, you're probably better off going to a private center and working as a in a private hospital and so on. But being a researcher does not make you rich. It makes your life easy because with all the grants that you receive, if you manage to put aside some fund for you to cover your publication fee, to start investigator-initiated studies and so on, it can certainly propel your career further from that. Okay, and as I said, research is not the way to become rich. I know. I think Datuk Khalid was like the highest earner of research grant in university up to some time. I did receive the award of highest grant 3 or 4 years ago, but that grant money, if you ask me, is belong to Bendahari UiTM. Kalau I nak keluarkan sendiri pun is a bit difficult because you have to follow the perkeliling from Bendahari and so on. So it's not you who are rich, it's the Bendahari UiTM who are rich. Okay, so that's not the main incentive. If you're really looking to do research because of the financial gain, you get frustrated. But if you put your aims for the sake of knowledge, for the improvement in terms of your patient's care, you get a lot of satisfaction from that.
Assalamualaikum, Prof.
Waalaikumsalam warahmatullah.
Emilia here.
Hi Emilia, welcome back.
Thank you. Thank you for the great talk. Actually, I just have some questions because I have been offered by one of my professor in UCL to bring in a study called Synapse study. It's funded by Wellcome Trust. But unfortunately, there's no grant given to us because it just involved of stratification of patients with rare movement disorders and or rare or familial movement disorders and epilepsy patients in Malaysia. And what we just need to do is we have to provide blood samples and send to them, and then it will be analyzed by the neurogenetic centers in London. So my question is, because I would like to apply this as the principal investigator, but I'm not too sure.
It's 15:30.
Sorry, it's my laptop clock. But I'm not too sure how, because you did mention in your first slide that you have to be qualified to be a PI. So I don't know whether do we have a criteria of PI in UITM?
We don't have actual criteria for PIs. Of course, if your professor invited you to be part of the investigator teams, you can decide whether you want to oblige or not. But looking at your intended research again, you do need probably my personal advice to you. You do probably need to ask your professor again in terms of some financial support there, because you do need, I mean, even to post your bloods overseas, you do need to have permit. You need to apply for permit from Jabatan Kesihatan, and of course the postage, the courier, and so on. So I'm not sure how they will ask you to run these studies in a center in Malaysia without any funding.
Itulah, that's the thing, because my plan is actually I will look for my own funding, just maybe apply for some grant, because it's an international collaboration. In fact, it's actually a multi-central international collaboration study. I think Malaysia in Asia, I think the only country in Asia that has been involved in this study is actually Central Asia. So I would like to bring in the study, but the problem is they do not offer, biasalah kedekut kan. Tapi so I would like.
Most of them would be like that. They will not readily offer you the fundings. But you do need. That's why it's important to have a proper agreement, because with you contributing the data, then you need to decide with them what will you get at the end.
So the gain is actually for our own patient, because as you know, in Malaysia, the genetic testing is very, very expensive. And most of our neurology patients do not get any diagnosis at all eventually, because they cannot afford to pay for the genetic testing. So one of the benefit of this study is actually it can benefit our patients, because we can provide them with genetic diagnosis if if the outcome is good. Especially that's why we select not all patients, but someone with familial ataupun consanguinity that produce a higher yield of genetic diagnosis. So basically, in one outcome is actually for our patient. They provide the bloods. We can also screen their family members if there is a family history, and they all can get a diagnosis. That's one thing. So kita tak payah bayar lah for the genetic testing. So that's number one. Number two tu lah sebab I did ask for grant from them, but unfortunately they are very tight, and I think biasalah, like you said, they always take advantage lah on this thing. But one of the benefit that they offer us is actually the authorship. So kalau kita berjaya provide patients that included in the study, then we can get the authorship lah, as not as an acknowledgement, but one of the co-authors in the paper. And usually this study they always publish in a big journal paper like Lancet, New England, and stuff like that. So tapi that's one, because I have never done any clinical trial before. I've never been a PI before, so I would like to. I did ask center before, but they said that to be a PI you have to be a consultant. in apa kena dapat title dulu and stuff like that, but I'm not sure that is it true?
Not necessarily. Sorry, I tak ada that slide. I think I missed out or remove it from the slide that I have. But I think the one that I've shared with Aisha, they've put in who can be the primary investigator. I think Aisha, if you have that, maybe you can share.
Yep.
And you don't have to be consultant to be a primary investigator, definitely.
Okay.
So that's not the main requirement. But my advice to you, you need to get a written agreement with them, because sharing my experience with all the previous sponsors and investigators, everything needs to be written. If it's not written, then it's difficult for us to claim and so on. And most of these collaborators from overseas, they would like to have access to our data and promise us everything and anything. But if it's not written on the piece of paper, then if it's not done, we cannot have valid reason to argue with them. So even if you don't get financial support and so on, you do need to have a written agreement with them, and they do need to provide you with the protocols of the studies, and perhaps you can apply for grants in Malaysia, because you do need to have funding to send the bloods over to them and so on, because it has to be done in a proper courier. You probably need to put that on dry ice or whatever.
Okay, thank you. Actually, memang we have discussed and we do agree to make a proper agreement. I do have a copy of their protocols and everything lah. They already give me the copy of protocols. Another thing is the consent form, because I was informed that the consent form must be multilingual. Because what they give is English, right? So kita kena translate to Malay, Indian and Mandarin.
Yes.
So in this case,
yeah. So that these are the things that you need to have the funding, because number one, with the genetic testing, you do need to have what we call a genetic counselor or a trained one. I'm sure most of the neurologists are trained to give genetic counseling. And you do need to pay the translator. And I know Institute, remember what's the full name of it? Institute Translation Malaysia, they do charge a significant amount. So, but most of these studies done overseas, they already have all those translated. So you just need to, especially when you don't get any fundings, they do provide you with all the translated version, with the protocol and so on. And most of it is there already.
Okay. Nanti I talk to them. Nak tanya, so actually, do you have to get the basically pass the ethical approval first before applying for funding? Before applying for the funding.
Of course. Okay. You cannot do anything without the ethical approval.
Okay, all right. Thank you. That's all.
Okay. So Prof, do you want to go through anything in?
So this is the definition of who can be the investigator. I think Aisha, you can share this later on with all the participants, because this is the I think if you're attending the GCP, this is the slide that you're gonna get. So I mean, the requirement to be a primary investigator is not being a consultant. Anyone can be a primary investigator.
Yep, as long as you finish your GCP. So that's I think that's the main thing, right?
I think I mentioned that earlier. You do need a GCP. You do need a GCP to run the studies. So if you've done your GCP, even if you are not the consultant yet, you can still do it.
Yeah. Amelia, just to highlight that center also have our consults. So if you are stuck with what to do, perhaps you can engage with us, and we can perhaps help you lead you to the right direction. Any other questions from the participants? So Prof, perhaps I think if there is no questions from the participants, one last say to the young potential PIs out there, just to motivate them a bit more to become PIs. What is your last say?
Doing research is not difficult. If you can work together, if you can work in a teams, there's always a way. Okay. If you resolve people who works alone, I think research probably not a thing for you. Okay. But if you are someone who can work in a team, in a functioning team, be a team player, any form of research is pretty much doable for you.
All right, well said, Prof. Thank you very much to Prof. Izuan, who has shared us with his views and responsibilities as a principal investigator. I'm sure it was a fruitful discussion to all. Thank you to all attendees that have participated in our webinar series. Don't forget to sign in. Your attendance link is provided in the chat room. Until we meet again next time. Thank you very much.